Your Excellency, the Ministry of Health, the Kingdom of Saudi Arabia, other ministers, ladies and gentlemen. It's a great honour to be here at this important meeting and to bring to the presentation the topic of physical activity. I'm delighted to see its positioning as one of the 4 core risk factors, and I'd suggest it's in relatively recent times that the area of physical activity, exercise, sports, has been recognised in this domain as fully as it is today. I'd like to start with my 4 or 5 key messages. I hope to remind you and convince you the evidence is strong on the health benefits of physical activity. Like the speakers before me, today's meeting, over the next few days, it's not so much about if or why, but in fact how. I'd like to introduce and remind that public education is an important part of our response to physical activity and all NCD risk factors. However, I will suggest that physical communications, mass media on physical activity is necessary but not sufficient on its own. We must look and implement activities and actions upstream. The solutions to address physical inactivity will require policy as well as programs. And finally, my 5th message is that we need to build the evidence base in this region. We have a strong evidence about the health benefits, but I will acknowledge that we have evidence gaps around population-level interventions showing the changes that will be necessary. We need to act on what we know and build an evidence base in doing so. We also need more capacity building in this area. And as one of the questions this morning has already addressed, we need to consider carefully the social desirability and the cultural adaptations in this region towards this risk factor. Let me, over the next 10 minutes, expand on these 5 points. The evidence, it is strong. Back in 1953, when Jerry Morris published his first paper on the benefits of being active during work with the London busman, through to the political declaration of last year, we have 60 years of evidence on the health benefits, and this morning's presentation have shown you the attributable risk, and it is a major concern. Most recently, a special issue of The Lancet with 5 papers looking at what we need to do. I draw your attention to this new resource. A reminder, this is a simplified picture, but it sums up the picture of the benefits. Following the yellow line, any activity is better than none. Activity in this regard can be through leisure, through recreation, through sport, but it can also be through transport, a major area of focus in Europe and elsewhere, walking and cycling to get from place to place. In addition, there's work and domestic-related physical activities, but I'm going to focus mostly on the first 2 because they are modifiable. But you can see from this graph, more activity brings more benefits at every level. We focus on the early and mid-stage because these are the health-enhancing zones. You can see also that risks increase. But in the early stages of doing some moderate intensity physical activity, the risks are low. This summarises the evidence for us and is the basis from which we promote physical activity in the NCD arena. We need to. The data from the 2008 estimates show us global patterns, and as you scan this, you can see in each region it ranges from at best 20%, but at worst 50% are inactive. Data are available for men and women and show men are more likely to be active than women. We're very concerned about the levels of participation in women. We have less data on children, but they show a huge drop-off after the age of 12 to 13. We're very worried about this pattern that we introduce so early in life. You can see also the problem of inactivity spans all regions, including this, and in all levels of economic development. It's not just these benefits of addressing the big 3, as I've called them here, cancer, cardiovascular disease and diabetes, but there are multiple benefits: mental health, social health, community connectedness, social capital, child development and education performance. The benefits from physical activity extend beyond the primary focus of today on the core NCDs, and it's an important agenda for many. And therefore I shift now to not if and why, but in fact picking up the theme introduced on how. The political declaration introduced many of the key factors across all risk factors. It requires collective, multi-sectorial action. We need to address the determinants of the risk factors. Whilst focusing on providing individuals choice, we must look at the environments and the policy arena and work in multi-sectoral collaborations. If we're going to look and address physical activity, we must look at the causes of physical inactivity. Looking across this, you can see its position there as one of the 4 risk factors. But what are the causes of inactivity? Much work has been done in other regions, but far less in this region to fully understand the social, cultural, environmental, policy, and economic aspects to this. We must explore those, understand them, and act on them. How? The first thing we must do is implement the policies and documents that already lay out a roadmap for addressing physical activity. These are shown here. Firstly, the guidelines, the global guidelines on physical activity. I'll come to those in a moment. The global strategy also has a map for us, a laid out list of actions that we should be considering and the applicability in this region, and indeed all the other tools. In Europe, those documents are many and perhaps not tailored to the region. So one suggestion for consideration is that the application of all these documents and policies need to be tailored, taking into account the cultural and social issues in this region, to look and provide more specific advice on action for these countries in this region. We also need to look at what specifics we can do. And one of the limitations in some of these documents is they're rather high level. And to introduce the idea that there are well-known interventions we can act on now, I'd like to turn to some work that has used the evidence, used the extensive research that's been done on many countries, in many countries, on many different approaches to physical activity, summarized in many leading guidance documents, notably these 2 being the USA Community Guide, in the UK the National Institute for Health and Clinical Effectiveness, Clinical Excellence. These summarize what we know and start to point to tangible things we can implement. Here I provide you a summary of those tangible areas, 7 of them. Time will not allow me to go into each of those very detailed, but I'd like to give you a flavour of each of them in brief, and this afternoon's round table will explore how we can implement these. The first is public education. I mention these because we have the global guidelines from 2010, a leading and at last consensus of global goals for physical activity. 30 minutes on most days of moderate intensity physical activity. We agree on that. We know that provides health benefits. Let's implement those. On the left of this slide you see many country guidelines. There's also regional guidelines, but we already now have global guidelines. I'd suggest that this is one area where we can act now to adopt and implement those in each country in this region. Why? Here I'd like to propose to you that guidelines are a core piece to our strategy. With guidelines we can set goals and targets and gain political commitment. We can build the important surveillance and monitoring around it and get intersectoral buy-in. The process of accepting those guidelines and then acting on them can be a building block to the national approach to physical activity within the NCD prevention. We can then add to that the mass media campaign that's required, a cost-effective buy from WHO's work previously introduced. The guidelines provide the core messages. If we know it's 30 minutes, we need to communicate that in culturally and socially acceptable ways. We need research to inform that, and here's just 1 or 2 examples, current examples underway. Sustained media campaigns can shift cultural and societal norms. It can also be a catalyst to this difficult but necessary partnership work. Whole of school is one of the other 7 areas. Whole of schools are known to be effective interventions. There is an established approach to this. Let's use it and let's implement it. Great success in the UK, which has adopted 10 areas. You can quickly see these areas are beyond just the curricula, but looking at school policy, looking at playtime, playgrounds, school facilities, before and after, travel to school, looking at both the policy and the programme agenda in the school setting. We can do this in the primary healthcare setting. In the UK, examples of making advice, counselling and assessment on physical activity a core part of primary healthcare. Not necessarily just the physician or GP, it can be other healthcare workers, but we need to build capacity. We need healthcare systems that support this approach. This was piloted and now is in national rollout. We need evaluation to show population change around these and other strategies. Workplace is another setting. Policy and programs around the workplace setting. There is much evidence and much could be applied here in the Arab region. I'd like to spend a moment on transport and the environment. It's not just telling people how to be active or to be active. We need to create the supportive environments through how we design communities, what we provide for whom, and the transport systems. Creating supportive environments is important globally. Here in the UK, travel to school can be dangerous. The solutions will be context specific. Weather and other factors will determine what does that mean here. We need to have an agenda to identify those solutions. What is a suitable, active environment in the cities and towns and districts in this region? Here I show you some work from South America where roads are closed to open up. Another way of encouraging and supporting activity. Lastly, sport for all. The next speaker will be addressing this, but it's an important setting. If we bring those together, the strategies in different settings are around the core functions of the guidelines and mass media. This is just one way of looking and unpicking how we can move from we need to act to acting. Can we do it? Yes. These are the front covers of many national policies on physical activity from around the world. I'm only aware of Kuwait that has a national policy. I acknowledge my colleague here in the audience. Other countries should develop the same kind of approach and learn and share. This will require leadership. Leadership that's here, leadership that we need to develop at all levels. Research from this region and a stronger workforce. Can it be done? Well, like tobacco and my previous speaker, it could be a long journey. Tobacco made changes. We are at an earlier stage for physical activity, but I believe a comprehensive approach can, in due course, give us this outcome in years to come. But it will require that coordinated implementation. There is no one single bullet for this problem of physical inactivity. An example of where this has been achieved is in Canada, following a participation, 20 years and a 20% increase over that period. The government stopped funding, stopped measuring, and there was a gap. There's a message in here both of progress but also warning. Thank you very much.
Yeah, thank you. Thank you very much indeed, Fiona. A lot to think about.